Okay, so imagine this. There's a silent energy thief, literally hiding in plain sight, just slowly draining your vitality and messing with your mind, and you don't even realize it's happening? Well, that is exactly what we're looking at in today's explainer as we unpack the 12 silent signs of a vitamin B12 deficiency.
Let me ask you something. Have you been feeling tired all the time lately? Or maybe you're forgetting really simple things, losing your train of thought? What about a weird, unexplained tingling in your hands or feet? You know, it's so easy to just brush these things off. We think, oh, it's just stress, or I didn't sleep well, or I'm just getting older. But what if it's not? What if these seemingly unconnected clues are actually your body crying out for one absolutely essential vitamin?
So, let's dive right into this. Here is our diagnostic checklist for today's investigation. We'll be covering 1. The silent energy thief. 2. Physical warning signs. 3. Brain and nerve signs. 4. Who is at risk? And finally, 5. Diagnosis and treatment.
But right before we play detective here, I really need to emphasize a crucial medical caveat. These symptoms do not automatically mean you have a vitamin B12 deficiency. There are so many different medical conditions that can cause similar problems. Our goal with this explainer isn't to diagnose you on the spot, but to empower you with the knowledge to go ask a healthcare professional the right questions and to see if proper testing actually makes sense for you.
All right, Section 1, the silent energy thief. Why B12 is the unsung hero of your body.
Think of vitamin B12 as the absolute hardest working factory worker that your body desperately needs to keep its internal assembly line moving. And what is that assembly line producing? Well, it makes healthy red blood cells, it maintains your nerve health, and it supports your brain function. These are incredibly high stakes for your everyday well-being. But here's a totally wild fact. Your liver can actually store a backup supply of B12 for up to 5 years. Because of that massive reserve, a deficiency creeps up on you incredibly slowly, and people often just ignore the subtle changes until the damage becomes really serious.
Moving into Section 2, physical warning signs. The body's cry for help.
So, the very first sign on our list is constant fatigue. And I'm not just talking about needing an extra cup of coffee in the afternoon. If you feel absolutely exhausted, even after getting a full, solid night's sleep, your body might not be making enough healthy red blood cells. Without B12, the factory essentially shuts down, and your energy levels literally just tank.
Now, when you have adequate B12 levels, you have normal oxygen delivery. But when those levels drop, suddenly there's way less oxygen reaching your body's tissues. This sets off a massive chain reaction. It leads directly to sign 6, which is shortness of breath or dizziness, because your organs are literally starved for oxygen even during light activity. And to compensate for that starvation, your heart starts working overtime, just racing and pounding, which brings us to sign 11, heart palpitations. It's a total domino effect, all starting from that one missing vitamin.
That ongoing oxygen starvation leads us right into sign 12, frequent weakness and a profound lack of energy. We are talking about situations where simple daily tasks, like climbing a single flight of stairs or just carrying a few light bags of groceries, suddenly feel impossibly difficult. It's almost as if you're trying to move underwater.
Okay, let's group these next 3 visually apparent signs together because they often show up right on your face. Sign 7 is pale or slightly yellow-looking skin. Basically, healthy red blood cells give your skin its normal, vibrant appearance, so a lack of them leaves you looking totally washed out. Then there are the uncomfortable mouth issues. Sign 8 is a sore, red, or unusually smooth and swollen tongue, making eating and speaking incredibly uncomfortable. And sign 9 includes painful mouth ulcers. If you're getting these persistent mouth sores alongside fatigue, B12 might just be the culprit.
Section 3. Brain and nerve signs. When the nervous system struggles.
Now, this is where the body's protective nerve armor starts to crack. You see, B12 acts as a physical shield to keep your nerves healthy. When those levels drop too low, that protective shield degrades. Healthy nerves give you normal, reliable sensation, but damaged nerves, which is sign 2 on our list, cause neurological misfires. You start getting these weird pins and needles sensations, numbness, or even a burning pain in your hands and feet.
And that damage builds directly into sign 3, difficulty with balance or walking. That nerve damage doesn't just cause tingling, it can actually strip your body of its ability to properly sense movement and spatial position. You might find yourself feeling surprisingly unsteady on your feet or losing your balance much more easily than you used to.
The nervous system extends right up into your head, putting your brain function under direct threat. So here are our final 3 signs clustered together. Sign 4 is memory problems or brain fog, like forgetting names or just struggling to concentrate on everyday tasks. Sign 5 involves mood changes. People can become unusually irritable, anxious, or even depressed when their brain isn't getting what it needs. And finally, sign 10 is blurred vision. In rare but very serious cases, untreated B12 deficiency can damage the optic nerve itself. If you suddenly notice vision problems along with these other signs, you absolutely need to seek prompt medical attention.
Section 4. Who is at risk? Identifying the prime suspects. So, who is most likely to deal with this? The most common prime suspects include older adults and vegetarians and vegans, mainly since B12 is mostly found in animal products. We also see this in people with certain stomach or intestinal conditions, folks taking long-term acid-reducing medicines, and post-stomach surgery patients, because their bodies simply struggle to absorb the vitamin efficiently. But listen, the crucial point is this. Absolutely anyone can develop a deficiency. You do not have to fit perfectly into one of these specific boxes to be at risk.
And that brings us to Section 5, Diagnosis and Treatment, Solving the Mystery.
Here is your action plan, really clear and simple. Step 1, do not ignore persistent symptoms. Please don't just write it off as getting older or working too hard. Step 2, speak to your doctor. And step 3, get a simple blood test for diagnosis. That is really all it takes to find out for sure. And catching it early through that simple blood test is the absolute key to preventing any permanent nerve damage.
Once you know, replenishing your B12 is actually very straightforward. Natural diet sources include meat, fish, eggs, and dairy. Now, if you follow a vegan diet, you will definitely want to look into fortified breakfast cereals, or more likely, explore the medical treatment side of things, taking daily supplements. For more severe deficiencies, your healthcare provider might even prescribe B12 injections to get your levels back up quickly and safely. Just be sure to consult your doctor to find the absolute best path for you.
The absolute main takeaway today is that early diagnosis dramatically improves your overall health. And because these signs are so easily mistaken for just everyday tiredness, please share this explainer with your family and friends. You literally never know who might recognize these symptoms and finally seek the help they've been needing. Also, if you found this breakdown helpful, be sure to hit that like button and subscribe to Doctorspective for more clear visual guides to your health.
So I'm going to leave you with this final provocative thought. Is your body asking for B12? Take a moment today to really listen to what your body is telling you. Don't let the silent energy thief win. Stay healthy, stay informed, and we'll see you in the next explainer.